It is without question that a pandemic such as Ebola or bird flu possesses a great number of security challenges to the sovereign state of Australia. However, to suggest that both possess the same destructive capability is an incorrect equivalency, even with our sound epidemiology. Ebola has the capacity to transfer from human to human as well as possesses numerous hindrances when it comes to its treatment and containment, the contents of which are discussed in this podcast. Ebola is a viral illness whose recent outbreak, reported in March 2014, can be traced to the Guayaquil prefecture in Guinea. Due to this region's importance as an epicenter of trade, the disease quickly spread to the bordering nation of Liberia. In June of the same year, the Médecins Sans Frontières described the outbreak as out of control due to the virulent strain of the virus. Avian influenza, or bird flu on the other hand, is a zoonosis disease whose causative agent is H5N1, which is carried in animals, predominantly birds. The primary reason as to why Ebola posed such a great security challenge to Australia was its systematic transmissibility. Members of the population were infected when they had direct contact through the broken skin, the nose or mouth, or through the bodily fluids of someone with Ebola. Furthermore, Ebola has the capacity to infect others through the transmission of seminal plasma for up to 3 months after the successful treatment of the disease. There is even evidence suggesting that Ebola virus can survive on surfaces for up to 6 days. Due to the virulent nature of the disease, the outbreak is killing between 50 and 60% of infected people, with the WHO revealing that there have been more than 10,000 Ebola-based deaths. In contrast, avian influenza, comprising of the H5N1 and H7N9 viruses, has not yet proved capable of spreading between people, limiting its overall global threat. It is an illness caused by many different strains of the influenza virus, which is adapted to specific hosts, most notably ducks and chickens. However, there is no substantial evidence of sustained mammalian transmission. Notable virologist Ron Faucier and his collaborators at Erasmus University Medical Center, in synchronicity with the work of Yahiro Kawaka at the University of Wisconsin, conducted numerous experiments to determine the transmissibility of the H5N1 strain within humans. The researchers discovered that through allowing the influenza virus to naturally circulate amongst a menagerie of animals, that the virus required 5 amino acid substitutions and an alteration of the N-like glycosylation sequence banding position to successfully allow for common mammalian polymerase adaptation. Thus, a sizable evolution of the original strains of the virus would be required to allow for successful human-to-human transmission through acts such as sternutation. Furthermore, as the virus gained transmissibility, it lost its overall lethality. Therefore, as Ebola has the capacity to successfully transfer between humans, it posed a greater security challenge to Australia's national security. Secondly, another major reason as to why Ebola constituted a greater security challenge to Australia was its level of unpredictability and the difficulty of containment. Due to the impoverished nature of the Ebola-ridden West African countries, they both lack the capital and facilities to ward off the virus. One BBC reporter claimed that the lack of resources has stymied the battle to combat Ebola, leaving countries teetering on the brink of collapse. Without adequate medical facilities and sterilisation, transmission of the Ebola virus continues to multiply. Furthermore, those most at risk from contracting the virus are health workers, typically from westernised countries. As they are required to work in exceptionally close proximity to those who are infected, their risk of infection is incredibly high. All it may take is a bead of perspiration for the virus to successfully migrate to a new host. Thus, health workers returning from West Africa pose a substantial threat to national security. For example, the case of Tom Eric Duncan elucidates the Brobdingnagian threat that Ebola poses to those countries who deployed aid workers to help quell the outbreak. After returning home from Liberia to the United States, he displayed symptoms of the virus 5 days after his arrival. If he had not been in quarantine for that time period, he could have interacted with copious amounts of people, further amplifying the scale of the virus and successfully establishing Ebola in the United States. Finally, there is no proven cure for Ebola. Experimental drugs such as ZMapp are in the testing stage, however their effectiveness is unproven, thus patients typically die from multiple organ failure and dehydration. Conversely, the nature of bird flu allowed for both systematic and successful treatment and prevention of the disease. Due to the virus's inability to successfully transfer from human to human, health workers were able to closely treat the disease without risk of personal contraction. Specific influenza antiviral medicines were used to treat human influenza infections. However, this medicine should be administered within the first 48 hours of the onset of the illness. Ergo, due to a lack of effective treatment and preventative measures, Ebola challenged Australia's security in a greater capacity than bird flu. Finally, the preventative measures adopted to combat these diseases sheds light on the perception of their severity and overall challenge to national security. For the prevention of Ebola within Australia, chief health experts met with border protection agencies on July 31, 2014 in an effort to excogitate the monitoring process of incoming passengers at our major airports. As a result, all incoming passengers were required to inform customs officers if they had been in an Ebola-affected country in the past 21 days. Furthermore, temperature screenings and infrared sensors were placed throughout the security checkpoints. In total, 11 people have been screened for Ebola, all of which returning a negative reading. Bird flu, on the other hand, only necessitated minor alterations to security. These included banning the importation of live poultry from countries with the avian influenza and inspection and quarantine of poultry meats. According to the National Action Plan for Human Influenza Pandemic, given the high standards of human and animal hygiene in Australia, it is unlikely that bird-to-human transmission will occur. Therefore, it can be seen that the more draconian actions implemented to prevent Ebola reveal the perception that it poses a greater security challenge to national security. Therefore, in conclusion, it is clear that Ebola poses a great security challenge to Australia. These types of issues are often reported through the prism of sensationalist media reporting in conjunction with Australia's zeitgeist of jingoistic xenophobia. However, the threat of bird flu pales into insignificance when the severity of Ebola is revealed. Not only is Ebola successful in mammalian transfers, both treatment and prevention prove incredibly difficult due to the virulent nature of the disease. Therefore, it is clear that Ebola poses a great security challenge to Australia.